Diane, you want to get started in about a minute? You're on mute.
I'm having issues. I made my Zoom screen really small and I'm trying to figure out how to, got it, never mind. Yes, I can do it whenever you say. No, I'm ready.
All right, it's 3 after. We got a lot of material to get through. So let's go ahead and get started and people will trickle in when they do.
Mariana, do you want me to start or are you going to give an introduction about what we're doing here?
I can give an introduction about what we're doing here. Yeah. Hi, welcome. So this is, I'm Mariana Padillas. I'm with the United Steelworkers with the organizing department. And joining us is Diane Stein, who's with the Tony Mazzocchi Center, which is related to the Steelworkers and does a lot of health and safety training. Today's health and safety training is because you all are starting school again and students are coming back and things are getting more dangerous. So this is going to be a presentation about COVID-19 workplace protections, about really a worker-centered view of health and safety in the workplace. And we're hoping to teach you some tools that you can hopefully apply in your workplaces to make them as safe as possible. So Diane, we're going to go for about an hour with Diane, and then we're going to break you out into different groups. Diane, let's go.
Thank you. So hi, everybody. As Mariana said, I work for the Tony Mazzocchi Center, and we are the safety and health training arm of the United Steelworkers Union. And we've been doing a lot of COVID training, as you can imagine. It's like the main thing we're doing. We're used to training in person, so for those who got here a minute early, you can tell that the technology is not my best, but I do know safety and health, so I think we're in good hands, and Alyssa is going to help me out with the technology, so thank you. I'm going to do, as Mariana said, my presentation is somewhere around an hour. That may or may not be enough information for you, and I just wanted to put it out there from the start that as you require more information, I'm not going anywhere. If you have specific topics that you think I'm going a little bit short on, forgive me. I'm trying to get through at least the basics on a lot of things, and then if you need more training later or just want more written material, I'm happy to work with Mariana and the organizers to get you exactly what you need. Next slide, please. So for tonight, we're going to talk about safety and health reps and committee members and how to evaluate your working conditions in the time of COVID. The learning objectives are to assess workplace exposure and to look at some different methods that we use in safety and health to prevent and respond to exposure at work. And there's a couple of other sort of things I want to say up front. And I'm sure everybody knows this because we're all reading the news all the time. The information on COVID is evolving daily. Because it's a novel virus, there is new information literally coming out every day. There are new studies. And so some of what we thought we knew in March, it may or may not be true now. And so one of the things that we have to all keep in mind is that whatever we're saying at a given time and whatever we're looking at in the workplace at a given time, it's going to take constant observation and evaluation to make sure that we're still on the right track to make sure that we're protecting ourselves. And the other thing I want to say right up front, because the safety and health class is two things. One is, even though the circumstances are different, the union has dealt with safety and health for years, and it's the same basic principles. So while it's going to be a lot of work to get it done, it's nothing brand new. The specifics may be, but the techniques are not. And the other one is, I don't know if anybody here has ever had experience with OSHA, but I do a lot of these trainings, and one of the first questions I get is, why can't we just call OSHA? Because they won't do anything for you. They're missing in action. And that's why it's up to all of us to really make sure that we're looking at the workplaces and doing what we can. Next slide, please. So because this is a 1-hour version of the class, and then you're going to have the chance to go and discuss in the breakout room sort of how you want to deal with the information, I'm not going through a lot of the health stuff, medical stuff about COVID that I do in some other classes. If you want that, we actually have other training opportunities through the Tony Mazzocchi Center, and that's our website. And you can always just Google USW Tony Mazzocchi Center and it will get you there. But I just wanted to put it out there that we do a lot of training And if you want more information on the basic stuff, it's probably a different class, but we'd love to welcome you to those classes. Next slide. All right, so can you use the chat for a minute? I want to get from you before I go into stuff. I at least want to find out, what are your biggest concerns about going back to campus because of COVID? Transportation, being held liable by the university. Working with kids, students not adhering, conflicting information. All right. Yeah, I mean, these are all of the basic questions that I anticipated we would have, and some will go into a little bit more in depth than others. But again, at the end of this, when I'm done, you're going to have a chance to really talk about this much more in depth in your smaller groups. But thank you for letting me know what your concerns are. Next slide, please. All right, the basic about COVID that I think we all probably know, but I just wanted to reinforce, is that it's highly contagious. It's spread person to person through talking, singing, breathing. It can be in droplet form or in aerosol. And then we talk about contact, meaning it's on a surface, you touch the surface and you have contact with it. And then you touch your face or your nose. Next slide, please. So until, I want to say, time is running together, right? Until I want to say about 2 to 3 weeks ago, this question of whether COVID was airborne in aerosols was a real controversial statement. Even though a lot of us that have been doing safety and health for years and have dealt with flu and Ebola and other infectious diseases, the question is it just a droplet that's a concern, or is it this mist like an aerosol? And I'm just going to take a second to explain that in the most basic terms. The difference really is size and how it travels. So if what's infectious is, you know, the gross stuff, it's coming out of our mouth and our noses, and it's coming out in the form of mucus. A lot of it is in a droplet, meaning it's fairly large. And if it's a large droplet, it's heavy and it drops fairly quickly. It doesn't linger in the air. And so that's where the 6-foot rule comes in, right? Because if it's not going that far, not lingering in the air, you're spewing it and it drops, then the 6-foot rule is fine. But there have been many people that have been saying for a while, it doesn't all stay in that large droplet form. And the way to think about it is, there are 2 ways. One, an example a coworker gave to me the other day is, it's like when, because I'm older, it's like when I was in high school and you'd go into the women's room, and you'd go into the girls' room, and somebody would use hairspray, and you go in there an hour later and you know that somebody who was there an hour ago used hairspray. It's because that mist stays in the air, that the smaller the droplet, the lighter it is, the more it's going to stay in the air and the farther it's going to travel. So if you think about that as a form of transmission, it really makes you rethink whether or not hand washing is the only thing we have to do, right? Because you're thinking about breathing it in. So about 2 to 3 weeks ago, there was a letter that went to the World Health Organization signed by 650 scientists saying, recognize that this is airborne, recognize aerosols. You can't just pretend, because it's easier to think about it that way, you can't pretend that it doesn't travel. And then there's a new study that came out 2 days ago. The slide I have up right now is from the New York Times on Tuesday. And this is the headline from it: a smoking gun, infectious coronavirus retrieved from hospital air. And what it found, what this study did was it showed that airborne virus plays a significant role in transmission, many experts believe. The new study fills in the missing piece that floating virus can infect cells. And so this is this floating, this makes it harder to deal with, but I think it's a really important concept that it may not just be that these are heavier drops that are falling down. And I added this quote, which was in the article, which is referenced here, but again, just Google the Times from Tuesday, because this is somebody from the University of Pittsburgh. This is a quote from her. The findings should also push people to heed precautions for airborne transmission, like improved ventilation, said Simo Lakdawala, a respiratory virus expert at the University of Pittsburgh. So I don't know if anybody knows her or works with her, but she was one of the experts quoted in the New York Times on Tuesday about this study, which was done at the University of Florida, saying we need to think about airborne, and if we're thinking about airborne, we have to think about ventilation. So next slide, please. I'm one of those people who finds it really handy to have these mnemonics where you can actually just have like a quick way to remember things. So there are 3 V's of transmission. If you want to think about transmission, and the reason you all need to think about transmission is that you can't think about protection until you know how transmission happens, right? You know how it gets around, then you can think about how to protect yourself. So the 3 V's of transmission are venue, ventilation, and vocalization. Next slide, please. And then this is the last one, but the 3 C's of risk: closed spaces, crowded places, and close conversations. And quite honestly, that's what I saw in your chats. That's exactly, you worded it differently, but that's exactly what you were talking about having concerns about. So the good news is I think you're looking at the right things. The challenging part is we're gonna work together to figure out what would be the right solutions, and you'll work with in your groups later about how to work with Pitt to make sure that they are instituting some of these controls that are the appropriate controls. Next slide, please. One of the questions I get, because contact is still an issue, so one of the questions I get is how long does COVID survive outside the body? And this is just a quick cheat sheet on it. Copper, it survives around 4 hours, cardboard 24, plastic and steel 72. Over time, so in March when this first started, or in February and March when this first started, I was really compulsive about when we took anything in from outside, either got mail delivered or did grocery shopping. If it was grocery shopping, we would take the Clorox wipe and wipe off anything that was a perishable, like a milk carton or an egg carton. And because I'm lazy, everything else, I didn't want to wash everything I got. Everything else I would put on my back porch for 72 hours thinking, all right, anything else is going to be fine because the virus dies after that long. Based on what I've been reading and also based on advice from CDC and other organizations, the contact stuff is less of a concern. It's really the airborne that people are much more concerned with now. So I'm still a compulsive hand washer after I've touched stuff. I'm a little less compulsive about leaving the mail aside for 3 days. But this is how long it survives. And the reason that people like me are less compulsive about it now is that while we know the virus can survive on these surfaces, there have been no reported cases that have come from that kind of contact. Next slide, please. And by the way, the hard part of doing this on Zoom is that I'm used to doing stuff in person and I can't see people's faces and I can't tell if I'm going too fast. If you want to use the chat to say, can you explain that again or slow down or whatever, feel free to do that. And I'll make sure I keep an eye on that. So if you're thinking about getting infected, then you want to know, when is this infection going to happen? And here's the thing. The incubation period between the time somebody is exposed and when they may get symptoms is generally 2 to 14 days after exposure. So for the first 2 days, I don't even have symptoms. I don't know that I have it, but I can still be contagious. As important or more important, about 50% of the people never get symptoms, which on one hand is a great thing, right? It means that many fewer people are getting sick, and that's a good thing. On the other hand, it means we don't know who's infected and who's not, because you can't tell just by looking and seeing how somebody feels. They may never have symptoms. One way that this has come up a lot with a lot of employers, not just employers, it's at the airport, it's everywhere, but a lot with employers is, particularly at the beginning, there was a big reliance on taking temperatures as a way to screen people out. I don't know if anybody has been through this, but from the very start, I was skeptical about that myself, because if 50% of the people have no symptoms and you can have a fever for any reason, why is taking a temperature? It seems like, I read one article that they called it COVID theater, that you can make a big show, an employer can make a big show of taking your temperature, but is that really protecting you from anything? And the answer is possibly a little bit if somebody has a fever and they didn't know they were sick and you can pull them away, but for the most part, no, it's not. So it's this incubation period makes this a very tricky disease. Next slide, please. which brings us to the precautionary principle. There's something in public health called the precautionary principle. And if you could do the next part of this slide. I think there's one more part to this. Yes, thank you. Simply stated, it means if you don't know whether there's a risk or not, don't wait for all the science to come in. Assume there's a risk and protect people accordingly. And I think that's a really important concept, especially when we're talking about this disease where so many people don't even get symptomatic. I'm not going to wait until I find out that my coworker has all sorts of symptoms. I'm going to try to take steps to reduce any possible exposure because I don't know if he or she is sick at all. Next slide, please. And this, by the way, that's a common principle in public health and in workplace safety and health, and we just need to apply it here. So that's sort of the really quick and dirty intro to that part of how exposure happens and how you begin to look at risk in the workplace. So the next part of this is going to be on assessing and addressing COVID as a workplace hazard. The purpose is to learn different methods of identifying and documenting points of exposure and to assess ways to prevent or mitigate the points of exposure you've identified. So what I'm going to do here is hopefully give you some tools that you can hopefully use when you go back to think about your own workplace and how you, because every workplace is going to have different issues. They're going to be similar, but they're going to be unique to your workplace. So what I'm going to do here is give you some tools that you can hopefully take back and use in your workplace. Next slide, please. Employers should have an infection control plan to prevent the spread of the virus and ensure safe working conditions. I'm sure you've all looked at it, but I just put the website up here for Pitt's plan. I went on it, I think I did not go on it yesterday. I went on it 2 days ago. They have a lot of stuff on it. There are still some blanks on it saying coming soon. But that's the kind of thing that I would, if I were working here, I would check pretty much on a daily basis to see what they're putting out there and whether or not you think it's adequate. And my quick read of it, not working at Pitt, was that some things were fine, other things I might want to push a little harder on. Next slide, please. Here, when you're assessing any risk of exposure in the workplace, not just Pitt, here are the things that are sort of in the backdrop, in the back of your mind when you're looking at it. One is the community disease rate high? Does the work setting require close contact with people? Do specific job tasks require close contact with people? I know this came up in the chat. Is any type of transportation involved both to and from work or at the workplace facility? And what controls have been put into place? And so when you go back and you look at that website and you look at Pitt's plan on their website, these 5 questions are what I keep in the back of my mind when I'm looking at a workplace plan. Next slide, please. Transportation. So I know that there are a lot of questions on that, and I moved to Pittsburgh from New York 4 years ago, and I still don't drive. I am a public transit girl, so I totally can relate to this. I'm used to living on the subways, and I didn't really change that much when I moved to Pittsburgh. So I have the same concerns about public transit. And there are mixed studies out there. I'm going to tell you, there's a bunch of, I've been reading a lot about it because I knew it was an issue for you. And there are a lot of studies, recent ones, that are saying it's really not as bad as you might think that it is. There are not a lot of known cases of infection from public transit. The bigger concern is if you're on a much longer ride. My skepticism on this, my question about this is I've been on the T and buses a few times in the past couple of months. They're empty. They're not going to stay empty forever. So this is what I was saying at the very beginning, that the science changes, that the findings change as the science is more sophisticated. I think that because everybody's been staying off public transit, these studies are showing that it's not that bad. And while I want to believe that, I don't know what's going to change once the buses become more crowded. But this is a compilation of the advice from most of the studies that are out there. Wear a mask at all times, we know that. Common sense stuff, right? Choose the least crowded transit option. The last time I took the T, which is a while ago, they weren't letting that many people on. They had half of the seats blocked off. I don't know how long that's going to continue, but that's what you want, is fewer people, you can have more space. Make the trip as short as possible. Prioritize well-ventilated subway cars or buses, keep the bus windows open. And this came out in one study in particular. that if you can get people to just be quiet and not, remember this is the vocalization, not talking or singing or like speaking while you're on the ride, if the more that happens, the less potential for COVID you're going to have in the air. So I've been on buses going through Oakland during the school year. I'm not sure how feasible this is going to be, but that really would be ideal. Exactly. Somebody's saying that there's difficulty contact tracing back to public transit. It's much easier to say that it's from a bar or something. Absolutely true. Again, that's also part of my skepticism of how accurate the studies are saying that there's nothing happening there, or there's very little happening there. Next slide, please. But let me just go back to that for 1 second. If you keep in mind that though that what you're looking at is duration of exposure and amount of exposure, there's still, like, if you can make the bus ride shorter, if you can walk part way there, I don't know how it works for people, but like the shorter the ride, the less crowded the bus, the more open windows and the quieter the bus, the better you will be. And that's true regardless of contact tracing. Those are all protections that will actually make the risk lower. Next slide, please. Again, this is a New York City thing, but I was surprised by this because it showed that there are ways in public transit even that you can make things safer. And the fresh air on New York City subways, when they talk about ventilation, you talk about the number of room changes per hour. And what that means is the number of times all the air in the room is changed out every hour. And the CDC, the Center for Disease Control, recommends 6 air changes per hour in hospitals. The New York City subways are 18 to 25 air changes per hour because they are so crowded. They have a need for more. But to me, when I read that, I thought it's feasible. It's feasible to do more air changes per hour if there is an incentive to do it. Because when you're coming across making an argument for a workplace change or for protection in the workplace, there are 2 main questions that come up. One is it technically feasible? And I put this up here to show that the answer is quite often yes, it is technically feasible. And then the question is, how do you get the employer to put out the money to do it? But if the answer to the first is no, then there's no question for the employer. So I wanted to put this up here to show that there are ways to do this. Next slide, please. So this is the part where you guys will be doing the work. I wanted to give you some tools when you go back to your own work site of how you can analyze what the hazards are at your work. And remember, you're going to be looking at going back to those 5 questions. What workplaces have you close together? What job tasks have you close together? And to do that, to figure out how to make it better, it's really important to figure out exactly what the problems are. So there are 2 ways that we do it, we at USW do it. The job hazard analysis, or what is also called a job safety analysis in some places, is a standard occupational safety and health, everybody does it this way, analysis of the work site. And basically, what you're doing is you're watching people work and you're talking to people and asking them what they do. But if I were to come to your workplace, I would just lay back for a while with my iPad and I would take notes on what you're doing and I would make some observations and I'd probably take some pictures if I'm allowed to. Because I want to see what you're doing, because quite often you will be hyper aware of what the risks are on your own job. There will be other things that you simply don't see anymore because you're so used to it, right? I mean, think about even in your own home. I'll speak for myself. Even in my own home, there's stuff I probably should have fixed a while ago, but I don't. I'm lazy, so I work around it. And it would take somebody else coming in to say to me, why is that like that? So it's a really good way to get a combination of people that really do know your workplace well, but maybe getting somebody in who has fresh eyes, who isn't used to looking at it quite that much. And I'll give you a form on this in a second. That's the very traditional way to do this, and it works well. The way that we like to do it more at the USW, because I actually think it works better, is something called hazard mapping. And we combine the 2, frankly. Hazard mapping is a visual representation of the hazards in the workplace, can be as general or specific as needed, and it's developed by workers, for workers. What we do is we draw a map, we draw a picture of your workplace and have everybody draw where they think the problems are. And you get everybody involved in it. You get a lot of input from everybody. So if I If I work, say we're talking about a break room and I always take my break at 11:30, somebody else takes their break at 12:30. It could be a very different situation because of the crowd size or whatever. I'm not going to know that just by looking at the room, but if I have this picture that everybody's getting involved in, you can find those things out. So if you could advance the next slide, we'll show you a picture of one. So this is just a job hazard analysis form, and Mariana has this form that she can share. It's just a really good way to make sure that when you're taking notes, you're not forgetting anything. It's basically like an enhanced checklist. And it gives you just a way to keep the data dated so that you know what's happening with it. And it's just, if you're going to be talking to your boss about it, it's a good way to have everything organized. So it's just one, there's plenty of examples online. That's just the one that I like to use. And you use this when you're talking to workers and observing the task. Next slide, please. I'm going to go past this one now because I think you're going to have time to talk about this in your groups later. So hazard mapping, we just talked about what it is. Can you go to the next slide, please? Sort of got ahead of myself. So this is a hazard map. And this is a hazard map of my office at the United Steelworkers. When we were looking at, our offices are shut down now largely. We go in occasionally, but they're mostly shut down. And in my office, when we were talking about, okay, when we go back in, what are we going to be looking at? We did our own hazard map. And I think in the end, every department at the USW did. So what we did is these little light blue things are cubicles. The darker lines on the left-hand side are private offices. And these blue lines on the right-hand side are file cabinets that we keep a lot of stuff on. So the coffee pot is on, we have like the waist-high file cabinets. We keep the coffee pot there. In the upper right-hand corner is where the Xerox machine is, the fax machine. So we were looking at it and we wanted to figure out, okay, what are the risks here? And can you go to the next slide, please? So it's color coded. So if you go, when we looked at it a second ago, it was color coded. There were some yellow dots on commonly touched surfaces, because if we're looking at COVID specifically, you want to look at commonly touched surfaces. You want to look at physical choking points where a lot of people are congregating. And then we had purple for other concerns because there are other things that can come up. And when you're drawing it, you draw a picture of the work area that you're concerned about. And you literally either take, when we do it in person, either take a magic marker or those dots you get at Staples, and you mark them with the color of what you're concerned about. And then you write on it what the number is. Is this a low risk or very high risk? And in our office, if I recall, the biggest risk was there's a choke point. The door where everybody comes in and goes out is right in front of you. And then immediately to the right is the coffee pot where everybody is quite frequently during the day and it's touched all the time. So we said that was our highest risk area because that's where we were likely to come together the most. So that's just one example, but if you start to think about how this applies to your own work site, it's a great visual way to do it. It's a great way you can leave it up for a few days in the workspace and have everybody contribute what their concerns are, and you get a really good picture of what's going on. And in safety and health, we use this all the time, not just for infectious disease, but we use it for electrical hazards and chemical hazards and ergonomic hazards. So we've been doing it this way literally for decades. Next slide, please. I'm not doing the breakout session because you all are doing that on your own. I was going to have you work on a hazard map on your own, but we'll just leave that so you can discuss for yourselves in your own work areas what's the best way to try to apply some of these tools. So once you've figured out what the hazards are, where the hazards are, then you have to figure out what the control is. And I'm just going to give you Occupational Safety and Health 101. This is a very basic thing, but it's just, again, a good way to organize your thoughts about how to control these hazards. This is called the hierarchy of controls. It's a very basic tool used in occupational health in general. And the basic premise is the best way to get rid of a hazard is to get rid of the hazard. These are on the top of the triangle to the bottom of it. They're in order of effectiveness. So eliminating the hazard would be the best way to do it. And we'll work our way down piece by piece. And the worst way or the least effective way to control a hazard is with personal protective equipment, which is often the first thing that people give you, right? Next slide, please. So I'm just going to take you through this triangle sort of one by one. So elimination and substitution are really the primo way to do this. It's a way to get rid of the hazard. Obviously, by definition, if you eliminate the hazard, you eliminate the hazard. If you substitute something, like this is common in chemical hazards, if you're using a cleaning agent or something that's pretty toxic, you can get something that's greener, that's less toxic, right? That's substituting. You're replacing it with something less hazardous. So the question is this possible with COVID-19? How would you eliminate the hazard? The only way to eliminate the hazard in COVID-19 outside of major public health work, which is a whole other discussion, is do what I'm doing now. I'm working at home. So if I am exposed to COVID, not require folks to work, give us an extension. Yeah, work on campus. Exactly. So the only elimination in COVID is to physically remove people from each other so that you don't have the potential exposure. Substitution, there is none in this case. What am I going to do? Like get the flu instead of COVID? There's no substitution here. So if we could go down to the next slide, please. Engineering controls are next. And again, because of the nature of it, this is really what would be the sort of top layer of level of protection. These are designed to remove or control the hazard at the source. This is what makes COVID so challenging. In a normal, I've been doing safety and health work for decades. And so in a normal safety and health issue that I have, the source, the hazard is an electrical hazard. It's a vat of chemicals. It's a cleaning agent. And there's a very specific place that I go to, I look at it, I find it, and I eliminate it at the source. The source here is all of us, right? Because we talked about the fact that we're all potentially infectious because we don't know who has it. So if you can't remove it at the, so to try to remove it at the source, these are typically things that are highly effective and don't require worker interaction. And if you can come up to the next slide, we'll give examples. So examples in COVID of engineering control, and I should flip these around because it's increasing ventilation and installing high efficiency filters. Because we're talking about it being airborne, really looking at ventilation is one way that you can control it without me personally having to do something. It's just there. There's airflow. We looked at the New York City subway and looked at how effective their airflow is. Another way is just a lot of our facilities at USW that we represent, people have to touch the time clock on their way in and out. Well, why would you do that now? Why would you have it so that one person after the next has to touch the same time clock? You can put in a different system. There were time clocks before there was the electronic version. I don't know if people want to think of other examples here or just wait till you're in your group, but I think that once you start looking at your own workplace and you start thinking, look at the workplace, figure out where the highest, where the hazard is, where the highest risk is, then you'll be able to start thinking about, okay, how can we control it? And when you're looking at those controls, just remember this hierarchy where you want to have it so that the best controls are the ones that require the least on each of us individually. Next slide, please. The next is administrative, which is work practices. This includes training and procedures, policies, shift designs to minimize the threat of a hazard to the worker. Next, so this is how work is organized, is really what it is. And next slide, please. Staggered breaks. A lot of stores, like for instance, or restaurants now are only allowing 25% occupancy right now, right? That's an administrative control. That is saying, we know the more people breathing in this room, the worse it's going to be. So we're going to limit the number of people that are in here. And then policies to accommodate the ability to take time off if you need it. A lot of people go into work because they can't afford to take off or they're pressured to. But if you know that you need to not be there, that's, again, OSHA's missing in action on this, but that's the kind of thing that, this is why I work through unions, and I'll speak for myself. This is why I work through unions, because it's the way that these things can be negotiated. Next slide, please. Bottom of the heap, very last in effectiveness is personal protective equipment. And I would have much more of a discussion on this if it wasn't on Zoom with like however many 53 people. But this is where there's a lot of reasons personal protective equipment is not the best means to protect, to control a hazard. First of all, it doesn't always work right. It doesn't always fit right. People don't always use it. That came up in the very first question I had for folks of what your concerns are, and several people put in there, I'm concerned people aren't doing what they should be doing. This personal protective equipment piece doesn't eliminate the hazard. It doesn't separate you from the hazard. It's counting on everybody to do the right thing. And people are human beings, and levels of compliance and just plain old levels of fit are different, and they're not always perfect. The hazard is still there. Next slide, please. So in this case, personal protective equipment is face shields, which face shields are a good barrier to the droplets. This is how we started. We talked about the droplets versus the very tiny aerosols that are like a mist. Face shields are great to avoid the splashes, but those tiny mist particles can still come around the face shield. So even if you're wearing things properly, they're not providing perfect protection. Gloves, by the way, the whole point of gloves is it doesn't substitute for hand washing. We all touch our faces, we all do that. And if I'm wearing gloves and the potential of COVID isn't getting on my hands, but it's on my gloves and I'm touching my face with the gloves, no difference, right? You're still gonna potentially get infected. Gowns, aprons, shoe covers, depending on the occupation. So this is more for healthcare, but I know you have some lab folks in here. Like if you go into healthcare, particularly in a COVID ward, they're covered head to toe, including like covering their shoes, because when you leave that area, you want to take everything off so that nothing underneath has been exposed. That is not what most of us thankfully have to deal with. And then respiratory protection, one of the, looking at the bright side, one of the advantages, or one of the upsides of having gone through this pandemic experience is that all of a sudden the general public knows like all about respirators and N95s, and it's like the little safety and health world has expanded. People are actually talking about workplace safety, which for those people like me, like we're really excited about that. So everybody knows what an N95 is now. And here's the difference. Next slide, please. I think it's on the next slide. There is a difference between, thank you, Kim. Kim says it's truly a dream come true. Yeah, I've been waiting decades that everybody talks safety and health. Cloth masks are different than respirators. And I know that there's a whole public service campaign around this, but I was out today, I wore a mask. I wear a mask to protect you, you wear a mask to protect me. That's about not spewing. It is not about making sure that I'm not breathing anything in, because a respirator is constructed very differently than the cloth masks that I wear. They have a tighter seal, they're made of a better filtering material. They are not the same thing. And one thing I would say is if you want more information, and we actually have some videos on our website, if you go to usw.org and you go to the safety and health page, there's a whole COVID page. And there are some videos that show the differences between cloth masks and respirators. Next slide, please. This is where Pitt's policies are. Again, I'm sure you know where this is. I just wanted to make sure that we had it up there for everybody who might need it. And next slide, please. Oh, thank you. Beth put in the chat the USW coronavirus resources. So that is the fastest I have ever done this, which probably came from talking too fast, and for that I apologize. Again, I started this off by saying I wanted to keep my part as basic and brief as I could, because I think the real value of this meeting tonight is for you all to talk to each other. I hope I gave you some tools. Really think about using the hazard mapping. It is an excellent tool to get your coworkers together to talk about what their concerns are. And once you identify the concerns, then you can begin to brainstorm together about what you think the controls should be. And that's just the process one has to go through. I've offered that if there is something very specific that you really want like a whole session on or more information, I can either give you written information through Mariana, or we could set up another training session to cover your specific issues. But I just want to thank you for your time. If anybody has a quick question in the chat, I think I could take it. Otherwise, I think you will be assigned to breakout rooms.
Yeah, let's take a few minutes and see if there's any questions. Thanks for that presentation, Diane. So we'll see if there's any questions, and then I have people broken out into breakout rooms. We're not going to come back together as a big group. So once your breakout's done, then the meeting will be done for you. I am not seeing anybody come up with any questions because you did such a fantastic job, Diane. It was very clear and informative. No, I'm being serious.
And thank you again, Melissa.
I'm gonna stop the recording.